Hi, I'm Dan Blake, and I'm really excited today to welcome Genevieve Glover from Barchester. She's the Group HR Director. Thank you for coming on today, Genevieve. Would you mind just quickly introducing yourself and maybe explaining how you got into care in the first place?
Yes, thank you. Pleasure to be here. So, as you said, I'm the Group HR Director at Barchester. I've been at Barchester for just over 5 years. My background is mostly in health, but previously in physical health, then moved into mental health, and then ended up into social care. So I suppose when I was approached about the role at Barchester, it seemed a natural transition from mental health. And also I've got elderly parents, so very aware of, family and friends that were in sort of different care environments as well. And that interested me.
Fantastic. So for those people that don't really know what a Group HR Director does, would you mind just explaining what that actually means and I guess what you do every day, if that's all right?
As everybody says, every day is different, particularly at Barchester, particularly at care in a pandemic. So for me, HR is about our people. It's also about the business, and it's about performance. I suppose that's my sort of simple way of looking at it. So functionally, I look after recruitment to Barchester, and we recruit around 6,000 people a year. Learning and development, so that's everything from apprenticeships right through to sort of level 7. Employee services, which is our reward and recognition, it's employee relations, it's eligibility and compliance, so overseas nurses, and also internal comms across the business, so how we communicate within the group from the sort of corporate head office, but also facilitate two-way communication from our services as well. I sit on the executive board, so with Pete Calverley, our CEO, also our Chief Finance Officer, Marketing and Customer Experience Director, General Counsel and Commercial Director. And in terms of what I do, every day is different. So in some ways it can feel a very flat organisation. So for example, today we had a webinar with a number of staff in our hospital and complex care division. So I was responding to questions that were coming through. So I could have been, engaging directly with one of the carers within our services, for example. But in another way, it's quite strategic and hierarchical in that, we have to ensure that whatever we do fits with our purpose, fits with our values, that we grow and develop our business. So, for example, we have new build homes opening later this year. We're looking at our systems at the moment. We've got a 3-year people strategy to write starting next year and that sort of thing. So it really is a wonderful mix of activity that keeps me busy.
Wow, maybe it's easy to say what you don't do next time rather than what you do. Sounds like you do a lot. So, you talked at the beginning about employee engagement, I think. So I'd be really interested to hear what you think about and how you approach engagement for your employees and, any tips you have, really.
Yeah, I mean, to me, positive employee engagement is incredibly important within any business, to be honest, but I think it's very real in a business where we care for residents and patients. If your employees are engaged, then it means that they will give consistently good care to residents and patients. And also, as we all know, discretionary effort, so people working beyond their hours, perhaps working beyond their remit, within reason, is all part and parcel of working in this sector. I think if people are positively engaged, then they're more likely to provide that discretionary effort. We measure our employee engagement because we feel it's important to do so. So we are the only healthcare provider in the best companies list, which means that we have our 1-star accreditation, and we have retained that as well. And we're also a top employer in 6 out of 11 regions across England. And for me, I think there are different elements to employee engagement, and it's around how you reward people. So sort of recognising and valuing them financially and non-financially, how you recognise what they're doing so that they feel they are making a difference, and also when they have gone above and beyond, it's recognised and celebrated. I think internal communication is key, so making sure people understand where they fit within their shift, within their team, within a service, and within the organisation as a whole, and also absolute clarity of expectations, so there's no confusion as to what their role is, whether it be that day or within their career. I think it's making sure that they have visibility of what the CQC described as the guiding minds of a business. So, management, whether that is the manager of your service, the manager of your regional division, or obviously, the executive board within Barchester. I think it's having a vision, a purpose. So it's the sort of story about the man sweeping the floor at the space station when somebody asked, what's your role here? And he responded, well, I'm helping to put a man on the moon. We've all got a role to play. I would argue that no one is more important than the other, because we need each other to deliver care, whatever role that you play, particularly in the service. You might be somebody who works in the kitchen, or you could be a housekeeper, but it's just as important as delivering that care directly. I think the strong values, although I haven't finished yet, I think there's lots of elements to it. They've got strong values is important, authentically important. We created ours with our staff members, so they told us what they felt were the values that we were demonstrating. And then opportunities to develop within a business as well. Some people want to be the best carer that they can be. Some people want to progress into something different, and it's giving them the opportunity to do so.
How do you? That's interesting. How do you measure? You said you measure engagement. How do you measure that? That's very interesting.
Yeah, so we do use sort of external third parties, because then you can benchmark yourselves either within sector or without a sector with their engagement surveys. We've also historically held internal engagement surveys, so literally just use SurveyMonkey. Ask questions, be clear about the questions that you ask, because sometimes you've got to be careful what you ask. People are going to respond honestly, and you have to know what you're going to do with that information. But also things like exit interviews. Some people leave because they are disengaged, and so it's interesting to understand why. I think there's something around the discretionary effort. We know in some of our services, let's be honest, all our services, it's extraordinary the additional discretionary effort people have shown. For example, where colleagues have had to self-isolate or been off sick, taken on additional shifts, etc. But also those services where people perhaps haven't been quite so teamy and collaborative in providing that care. And then finally, you can't ignore the fact that people choose to provide feedback through Indeed and Glassdoor. We track that as well. Okay,
fair enough. So a sort of a 360 approach. You mentioned internal comms. That'd be interesting to hear about. I think some people view it as sending an email once a month, but I imagine you probably do a bit more than that. So how do you approach internal comms, and any tips to smaller providers out there, maybe that any lessons they can learn?
Yes, big believer in good internal comms. 2 years ago, we didn't have a kind of an internal comms function. The responsibility didn't really sit anywhere. We just sort of made it up as we went along, to be honest. And so we now have a team of 1.5 who lead on this across our 246 sites. And for me, it's a positive part of engaging with your employees and ensuring that strong engagement. I think it can be quite simple. They do take the mickey out of me when I say it's about saying the right things at the right time to the right people. But that is it. It's about clear, what you want to say, who you're going to say it to, when you need to say it, and what outcome you are after. Is it a case that you're just informing them of something? Is there a call to action? Is there something expected of them as an outcome? And then we have a matrix. So within our services, what do we think our general managers need to know? What do we think our nurses need to know? What do we think all staff need to know? And then is it daily, weekly, monthly, quarterly, annually? It's as simple as that. And I think measuring it is quite tricky. There are ways in which you can kind of track take up, for example, of training or that sort of thing. We have critical alert system, which means people have to explicitly say that they've read something. But I think people will tell you if they it could be that they're telling you by walking out of the business, or they'll tell you in a more explicit way if they feel they're not being communicated with. I think also there's something around consistency in communication. So what do you want to reinforce? So for Barchester, we constantly reinforce the fact that the quality of care comes first in everything that we do, everything, all our decisions that we make, if it puts our quality of care first, you know, and the safety of our residents and patients at the moment, then that's what we reiterate, and we weave that in through our communication. Big believer that if you say you're going to say something and then you don't say anything,
yeah, sure,
then people will fill that void. So, you know, say something even if you've got nothing to say. I've learned that the hard way. And then finally, I think it's a two-way thing. So we have an email address, suggestions@barchester.com, that goes straight through to me and Pete, the CEO.
all right.
And he normally responds more quickly than I can for the questions that come in. And you know, sometimes they're suggestions, sometimes they are queries or concerns, ideas, etc. So give people the opportunity to voice their opinions and ideas. SurveyMonkey emails. It doesn't have to be expensive or complicated.
That's interesting that you talk about the two-way side. I think some people think internal comms may just be a one-way thing, but it sounds like you have a culture there where you encourage people to raise concerns or suggestions, which is great. For those people who are listening, thank you for joining. If you do have questions, there'll be a time at the end, but there's also a chat function, so you can put them in there, and I will try and weave them in for you. So I think you talked a bit about developing people there, and obviously there are some benefits. It'd be interesting in such a broad organisation, you know, how do you kind of do it in such a way that it's tailored enough to the individual's need, but potentially, you know, scalable enough that you can actually deliver it across, I guess, many thousands of employees.
Yeah, I mean, it's, you know, developing people is going back to my answer to the original question. It's about performance. You know, if you stand still, you're going backwards, I suppose, simply. So it's important that we give everyone the opportunity to realise their own potential, to help their line manager to see that potential in them, and then as an organisation to then see how we develop that potential, whether it is, as I say, to be the best carer, housekeeper, chef, or whether they want to progress along a pathway. I mean, at Barchester, we have pathways that we provide. So we do have, you know, a clinical pathway that takes you from carer to senior carer, care practitioner, you know, nurse associate, nurse, and then on to deputy general manager, etc. We have an operational leadership pathway as well, and we're building other pathways as we go, for example, in hospitality, etc. So we have that, and then people can see what the next roll up does, what they need to know to be able to do it, you know, what qualifications and support and learning and development will provide to help them to make that move along that pathway. You know, clearly supervisions and appraisals are a key part of that. There's an opportunity to express and discuss, you know, aspirations, where things have exceeded expectations, where something needs a bit more work, a bit of honest feedback, you know, where we can support their development further. And then obviously at group level, we look at it, you know, completion rates for statutory and mandatory training. Yep. And we can break that down by service, region, division, group, and it gives us sort of full visibility of engagement in that side of things. Does that answer your question?
Yeah, I guess so. You must have some pretty sophisticated systems then to track some of that stuff, I'm guessing. Hoping.
Sophisticated systems. Yes, I mean, we have 19,000 staff, and we work with paper files and Excel spreadsheets. So we don't have an HRIS. You know, we sort of tag on some employee data onto a sort of payroll system that's also been kind of evolved to handle resident data as well. So no, it's not sophisticated at all. We managed to create quite a bit of data, quite proud of how that's evolved over my 5 years into a people dashboard that we discuss at sort of board level right through into our services. But at times it feels like that we're managing to achieve that data despite rather than because our systems.
Well, that's actually really interesting, and we're going to go slightly off topic because I guess, you know, part of this webinar, this podcast, is about giving some practical guidance to smaller providers that don't necessarily have the budget that maybe someone like a Barchester has. So, but it sounds like potentially you don't necessarily have, you know, it's reassuring in a way, maybe for some smaller providers, you don't have, you know, magic systems and processes potentially that solve all your problems. So I guess from all your learnings, do you have a sort of, you know, 2, 3, 4, whatever number you want, kind of smaller practical tips that you could give to, you know, how you can improve engagement, internal comms, learning development, you know, whatever you want, whatever under your remit, that maybe some of our listeners could learn from?
Right, and where to start? I mean, I think from a data perspective, you know, I mean, I think across 246 services, it's important that we have visibility across the group, and that we can also drill down, because, you know, when you talk about sort of training take up, for example, you can say our aspiration is 95% minimum, and that across the group we've achieved that. But then you might look at one division, and that's at 98, and you look at another division and that's at, you know, 88, for example. The devil's always in the detail, and I think it's important we have that. If you work in one service, then there's no need necessarily to look at kind of the macro data, because it's all quite granular and you can respond to what's in front of you. I mean, I'm not really sure what the tipping point is in terms of size, but having worked in smaller businesses before, you can buy some pretty cheap and cheerful off-the-shelf technology to support you, maybe if you have multiple services, which obviously means that your staff group is increasing. I mean, in terms of the systems, for me, I think it's about, particularly from an HR perspective, having staff members who deal with people, with HR, who are analytical, who are genuinely curious. I think for me that is, so however your data is served up, they know what they're looking at. They are curious to understand, you know, how accurate it is, because obviously the data is only good as the information you put in, and then they know what to do with it. I think that's probably would be my top tip, and that's probably for anybody, because even if you have a clinical role, you have a more operational role, you're still going to be involved with people and data.
So I think what I'm hearing you say is, you know, try and track things, try and get data. Don't worry too much about, you know, necessarily at the beginning how you're doing it, but then be a bit curious and look into what it's telling you. Maybe get good at Excel. Maybe is your top tip. Indeed. The world runs on Excel, I think. So I guess that answers one question I had, was about, you know, the one thing that you know, if you could just give one piece of advice to a small home manager or a small a budding aspiring people manager, HR manager in a smaller group, you know, would it be get good at Excel, or would it be something else?
Cool. I mean, for me, I mean, I don't think there's any one thing really. I mean, I did reflect on that, because clearly I had a little peek at the questions, and I think, you know, ultimately we are reliant on our people doing the right thing, and so, you know, ignoring the data. I think if you work in one home environment, you can see whether your people are doing the right thing. So it's about giving them the confidence, and part of that is the kind of clarity of understanding what they're doing, and, you know, the training, which is the competence to be able to do what they need to do. That's probably for me, particularly in care. You know, I think it goes back to the quality of care comes first. If you can see people delivering the quality of care that you would want to receive yourself or your loved one to receive, then you know, then you look at the data. There's no point in getting lost in an Excel spreadsheet if people aren't delivering the care that you need.
Sure. I once heard someone say that you should drink more tea, which I think was a way of saying that you should, you know, just take time to spend time with other people, to, you know, maybe you can have another warm drink as well. But that was an interesting piece of advice I had. What about have you come across anything that's, you know, that you point people to that's maybe free or cost effective? You mentioned there are a few things out there which are cheap, but I know COVID has brought lots of things out there which people can access, but it's quite hard to find them in a single place. Have you got any tips on things that people can use?
Yeah, I mean, I did reflect on this, and I wrote a few things down actually, because I think there are kind of opportunities across the sort of different functional areas. I mean, I think from a learning and development perspective, and there's an increasing push around that, and I think last week was Apprenticeship Week. Was it National Apprenticeship Week? Should know that. But anyway, it's apprenticeships. You know, whatever your size of your levy, our levy is £1.7 million, which I can't imagine is there's the same scale as everybody else is on this, but I think you use that levy, whatever you think politically about what it is, there's an opportunity to use that levy, draw down against that levy, and create apprenticeship roles within your services. There's also traineeships, which are sort of unpaid skills development. And I think there's an opportunity there. And also don't forget, at the moment, the context has changed.
Yeah.
Social care, there's a greater awareness of social care. I think there's a greater respect of social care, particularly when it fits alongside the interdependencies with the NHS. There's a greater range of people who just haven't got work and who have skills from other sectors that, quite frankly, have tanked, that they may be able to apply elsewhere. So I think all bets are off in this. I think there's also something my director of L&D told me called the adult education budget, which is in place, can pay for diplomas and functional skills. So that's what we're looking at.
Okay.
Then also the Skills for Care Workforce Development Fund. So in exchange for sharing data, then you can use the fund to pay for certain qualifications. So that's on the L&D. Internal comms, I think I've probably covered in terms of, for me, it's less about fancy stuff. It's more about being clear about what you want to say, to whom, when, why, with what action, and then using email or SurveyMonkey or posters. I mean, in terms of the communication for the vaccine program at the moment, we are using anything and everything as a way of engaging with our staff and informing them and answering their queries. And then in terms of engagement, again, it doesn't have to be financial recognition for staff. A personal letter from the CEO has incredible weight. A certificate has incredible weight. A hall of fame, so it's shared with colleagues and the residents and the relatives and the visiting health professionals, has huge weight. An extra day off, I know it has a cost, but really, that there are ways in which, creatively, you can recognise people to ensure that they feel that they're making that difference. So those are probably the sort of things that I would pick out on that.
It's interesting. I was chatting to another provider the other day, and they said they've started to advertise for general assistants. I don't know, you probably been doing this for years, but so people come in with a bit more variety of work as opposed to just doing, either you're in the kitchen or your laundry or you're domestic or you're a carer. So, and they said that's really helped with engaging staff, really, and giving them flexibility to selfishly cover their rotas more efficiently as well. So
indeed, no, I mean, I think I'm a big fan of a general assistant. We have used it for a while, but I think it's come into its own, particularly during COVID, where we've had scenarios with individuals who have been off for long periods of time. And it means that, we know that if we have a general assistant, we need to skill them up very quickly to perhaps be more hands-on a carer. We know what learning specifically they need to be able to do so. So it means you've got that sort of agility of working and filling your shifts, but also gives the opportunity for maybe people who are new to care to get an understanding of every role within a service and decide which path that they might want to take if they want to specialise. So I think it's an important addition. I mean, we have also at Barchester have what we call our whole home approach, which means that everybody in the service, whether you are a carer, a nurse, housekeeping, maintenance, you name it, there are core moments throughout a day where everybody is all hands-on to ensure that, for example, residents have their lunch where and when they want it.
Okay.
For example. So if everyone chooses, 12:30 at lunchtime, it means that everyone's all hands on deck to ensure that that's what they get because it's their home, and we've given them that choice. So it's an important part of that.
There's some interesting learnings there. So COVID, I guess, we're remiss not to talk about that. That's been fairly hugely impacting the sector. Rather than talking about some of the negatives, maybe I'll be interested to hear about how you've adjusted your people strategy, people plan, tactical people implementation to cope with COVID, and maybe how you see it changing in the future.
Yeah, I mean, it's an interesting one because I think, if anything, it's more about the sort of priorities. For example, we like to think we had a pretty comprehensive physical, mental, financial health and well-being offer for our staff. But clearly we took the opportunity to review and to consider what more we can do to support our team members, both individually and collectively in that. So it was really more about sort of prioritising where our focus was. I mean, obviously there's the obvious things like, pre-COVID, around 65% of our learning was online, and now that's, you know, almost 100%.
Okay.
But I think also important things like the sort of quality assurance piece around learning, so making sure that people are, you know, have an improved quality of learning and are applying the learning. So how we deliver that remotely has been quite challenging, and skilling up our operational trainers. So we have a trainer per region, so they look after sort of 10 to 12 services, and how we skilled those guys up to deliver training remotely as well. We also created a new role, so you know, in recognition of the fact that, you know, perhaps in nursing environments, nurses may be absent for whatever reason, or residential environments, you might have senior carers or care practitioners that would be absent. So we created an advanced carer role, which we have been just overwhelmed with people applying for that. And the feedback has been that, you know, it's almost kind of re-energized, re-engaged them, not only in the sector, but also in their own development and progression, which is fantastic. So it's a good problem to have, because they all want to become nurses now, so we're going to think about how we do with that. Right. And then also the way in which, so we have 3 learning leadership development facilitators, and, you know, it's given us the opportunity to use those 3 very skilled and experienced individuals in supporting our leaders within the business. So it could be providing kind of bite-sized learning. So a particular challenge like divisional support teams, we work remotely. So how do you engage with them to ensure that you're, you know, all aligned, you know, supported, right through to coaching conversations, right through to, we've been facilitating sort of peer-to-peer coffee mornings. So basically creating a virtual space for general managers to talk to general managers in a sort of protected environment. So there's nobody else there other than general managers, so they know what each other's going through. We can only imagine what those guys have been going through, but they know, and they've been providing the supports to each other in that way, which has been very valued. So yeah, I mean, you know, I think ultimately when you work in any role, but it feels particularly in the care sector, you have to you know, if you go back to the priority being the quality of care to your residents and patients, you do whatever's required. So, I mean, I did a facilitated session. On the wall behind me, I got some of that sort of plastic paper that you stick on it, and we did I got some coloured pens once I'd managed to take them back from my 9-year-old. And we had a session, we just sort of brainstormed what we felt our priority was. So we worked on missions, short missions, because we'd done some work with a sort of former military sort of leadership development guy this time last year, and we used one of his tools to enable that. So we had short-term missions, you know, what was our focus, how are we going to support our operational leaders, you know, in March, how are we going to do it in July, how are we going to do it in November, and at the moment, you know, our mission number 5 is around the vaccination program. And so it really focuses across the different functions: recruitment, development, employee services, and internal comms. What do we need to do to ensure that we achieve that, you know, near 100% engagement with the vaccination program, for example?
That's interesting. I think maybe you're taking a bit out the leaf out of the Google book, because they used to let their employees write on the walls, and they said that you know, if your child wants to write on the wall, you should let them. So, but I see that you've taken it down. So halfway there. What do you do? How do you? I mean, you did allude to it. You know, a lot of your general managers, home managers, you know, they have been at the front of a very difficult, challenging period that's, you know, still very difficult and challenging. How do you balance those that say, I'm just too busy to get involved in this kind of people stuff, versus those that do? I mean, how do you manage that, and what do you say to them? Yes,
I mean, you know, we're all very aware, particularly those of us that are sitting in what somebody described the other day as your Zoom box. You know, that we are sitting in our studies, living rooms, kitchens, whatever. We're not in our services. We can't and haven't been for a year, nearly a year now. And that we're very mindful with every request for, you know, data to be put into a clinical governance system, or, you know, LFD test results going into the government recording system, or, you know, whatever it is, an engagement survey, that it's just another request of them. Of course. You know, ultimately, we as a support team, we are there to support them. that's what we are here to do. So, we do that as much as we can. Some people, particularly if they have an outbreak in their service, we can be, even more supportive. Whilst others, touch wood, have been very lucky to have not had an outbreak at all, over the last 12 months. So I suppose it's being empathetic and kind of respectful of that. And then it's also about knowing your operational leaders.
Sure.
You know if somebody is saying something, if they're saying that they're struggling, those where if they're actually saying it, then they must be, and there's additional support. But I suppose ultimately, it's helping them to balance the priority. Number one, makes it really simple. You go back to the fact that number one is the quality of the care for the residents and patients. I think we have found increasingly that they have found it helpful to talk it through with either an HR business partner or one of the leadership development facilitators or their regional director to kind of help them. Sometimes verbalizing it helps them to kind of understand what the priorities are, because in some cases everything that we're asking them to do has to happen. And in terms of the people stuff, as we talked about before we went live, I think there's an opportunity to highlight, to recognize, to celebrate, to learn whether you're in a pandemic or not. It just looks different. Our Employee of the Month scheme became Employee of the Week because there were so many people doing so many amazing things. I tell you what, we found 92% of our services found time to do Employee of the Week every week. So it's all, these our general managers, our home managers, whether it's Barchester or elsewhere, they're such seasoned and experienced people managers. They know what needs to be done to ensure that they provide the strong leadership, particularly that they've needed to at the moment, but also provide that kind of nurturing and guidance to help staff to deliver care for our residents and patients.
So it sounds a bit like some agility, but also some flexibility. And, I think it's probably maybe an overused term, but sort of being person-centered to your team as well, because
Absolutely.
It doesn't sound like, I guess from the outside, a big beast like Barchester could be seen as a machine, but it does sound like you are considering the needs of the individual as well as the organisation, with the balance appropriate. Almost coming to the end now. I've had a couple of questions. We'll get there in a minute. Thank you for the questions. Keep them coming in. Technology. So it doesn't sound like you're at the cutting edge, and maybe Elon Musk is not going to be worried about Barchester beating him to Mars. But what do you think? How do you think the approach to technology has changed? You've already said that more e-learning, more learning online. But how do you see it changing, and how do you see it evolving in the next few years?
Yeah, I suppose going back to the sort of first question you asked of me as to kind of what I do every day. We have, just before Christmas, we had a conversation as an exec board mapping out our sort of 5-year roadmap for systems development. We don't have any sort of e-care functionality within our homes, which means our carers and nurses are having to write on pieces of paper for every resident, which some might prefer, but really it's just not the way forward. As I mentioned, the Excel spreadsheets and paper files. So certainly for us as a business, the ability to be able to view behind the scenes the employee journey and experience from the minute they are a candidate right through to the minute they leave us in one go seamlessly, I think would be extraordinarily powerful, because it will give me and my guys the opportunity to improve that experience at key points. And that no matter what hat you're wearing, director of recruitment, director of L&D, director of employee services, we would look at it from the employee's perspective, because then that would bring the benefit to the business. And I think from an employee perspective, for them to have that on their smartphone, for example, everything accessible on their smartphone. And we do have a version of the app which is quite good, but I just think that could be hugely sophisticated as well. So that's probably my vision from an HR perspective. And then really it's about technology that will help our people deliver care.
Of course.
So ultimately it's about making things quicker and easier and more effective, so that they can spend more time one-to-one with our residents and patients. So e-care planning will be key. We're rolling out a time and attendance system, which incredibly positive feedback, both corporately and from our staff as well. So again, because of the scale of the business, it'll probably take us another 18 months to roll that out. But when it's there, it will be awesome for everybody. It's that sort of thing. It's really about not really scalability. It's about improving the experience for our staff and our residents.
Fair enough. Last couple of questions. So those people looking to get into social care, maybe HR type individuals who are maybe working in different sectors, or even people working in the care sector. As I say, this webinar is generally geared at sort of, you know, home manager type level and above. Any tips on? I mean, you're clearly doing an okay job. You're pretty senior in the industry. Any tips on how people should take the next steps and what they should do?
Yeah, I mean, certainly to kind of plug Barchester, you know, we have 246 nursing residential homes, as well as complex care environments, and a small handful of private hospitals. So, and it's UK wide, so England, Scotland, Wales, and Jersey. So, you know, there's always an opportunity within our services. We are culturally, sort of pre-COVID, we were always used to working from wherever and whenever sometimes to sort of do our job. So we have, you know, offices in Inverness, we have offices sort of northeast, Milton Keynes, and then a small corporate office in the centre of London. But actually it doesn't really matter because we all work from wherever, and we used to get on the train quite a bit. So in that regard, it's, you know, there are a range of opportunities there. We do have BarchesterCareers.com, which lists all our the job opportunities that are available, and hopefully we've just refreshed it actually. So hopefully it gives you a real sort of clear understanding of what Barchester is like as an employer. So yes, I mean, in terms of the sector, you know, I love this sector, actually, if I'm honest. You know, I moved, it was actually prior to mental health, I worked in the music business. So go figure, it was just the way the opportunities arose. But it is that kind of balance for me of the sort of commercial side of things. And, you know, ultimately I'm a commercial animal. At the same time, that sort of higher sense of purpose, never more so than now. And I think the spotlight that's on the sector currently, eventually, is a good thing. I feel, you know, incredibly proud to be part of it, and incredibly proud to support my colleagues in our services and the amazing things that they've been doing.
Fantastic. Well, that's a good advert if ever I've heard one. So yeah, look at the Barchester website, plenty of opportunities. That's fantastic. So I've only really got one. I've had a question that's come from a Barchester employee, which is quite specific, and I'll just send it to you. I'll send it to you about some glycerine sticks. So I'll send that to you, and then maybe you can answer that one. One from a lady called 𝐥𝐸𝐤𝐤. Do you know her?
I don't.
Okay, that's good. That's good. It's not a plant. She said, and I think you have alluded to it, but I guess it's only fair to address it because she was brave and she asked the first question. In such a large company, how do you keep things person-centered? Which I think is a good question.
That's a good question, because I know that, you know, from looking at exit interviews, for example, and also talking to people who have chosen not to join Barchester, you know, there's the fact that they perceive us to be quite corporate, and you know, of course we are. If you know, if you're working for a single site provider, we must feel very corporate, and we have what we call the Barchester way, which is, you know, a framework for how we run our services and deliver good care and try and get that consistency. So, you know, on the flip side, you know, the feedback from a number of people that I've spoken to in our services, they've been really pleased to be part of a bigger organisation during a pandemic, because we've been able to secure, you know, all the PPE that we need. We've been able to influence sort of, you know, government guidance. We've been able to update all our knowledge in the different territories, in the different regions, the different tiers, the different lockdown definitions, the impact on visiting, the different testing, you name it, and they have been very appreciative of that. But for me, I think it's the culture. You know, the classic, you know, culture eats strategy for breakfast. You know, Pete Calverley, who's our CEO, he's a very down-to-earth individual. You know, I've worked in a variety of roles in a variety of sectors, and he is the only CEO that I have come across who is happy, genuinely happy to answer any question. So he's incredibly approachable. I mean, I think partly it's the fact that he, was a GP back in the day, so he's a medical doctor. But he's happy to answer any question, and he's very approachable. And so there's at times where, for example, on the webinars we're doing at the moment, where I'm having to say, Pete, you can't answer every question. An hour and a half later, we're still on the webinar, and he's still working his way through the questions. And I think that genuine, person to person on a level, two-way conversations, which he does have, whether it be in one of our quality first conferences face to face, we have our Pete surgeries, where he says to anybody, ask any question, and people do, and he answers.
Okay.
I think that sort of culture just filters through, and then we as a senior team, I'd like to think that we're all pretty approachable and are the same, and again, it just sort of filters through in how we work.
I may be wrong, but I think Pete's famous for having done the most number of vasectomies in a certain area in a year or something, which I'm sure
he's incredibly proud of that.
I mean, I heard that one too, so that's an interesting one. Good for him. Another question actually just come in. So I think this is a good question. So a visit to the HR team is often associated when something has gone wrong. How would you advise aspiring managers, younger managers, to change that view?
Yeah, I must admit the HR stereotypes, still they are there. I mean, I am not what I would call, I don't kind of fit with any stereotype, to be fair, but I certainly don't fit with an HR stereotype. My kind of professional background doesn't lend itself to it. I swear in work sometimes, carefully, obviously, but I like to think
I don't believe that.
Well, I swore with you before we put the recording on.
I don't believe.
So I don't know. I mean, for me, that's why I said at the beginning that I think HR is about performance. It's not. Yes, we have a role to play with the tea and tissues. Absolutely. We've created a framework for that. But ultimately, every single function in the business, whether you're IT, HR, finance, sales, marketing, our job is the performance of the business, according to whoever your kind of stakeholders or shareholders are, whether you're a charity or privately owned. That's what we're there for, in the delivery of whatever your purpose is. So, I think you need to be very clear as a general manager or a lowercase g, or as an HR person, that's what you're there for, and you've got to be able to demonstrate it. So and that could be making sure that you talk the language of the business. It's really important to understand how the business performance is measured, but also if people do flip to the lazy stereotypes, you blow those out the water.
Great. We've got 3 minutes left, and one more question's come in, which is a good one. So it's about social care in general, and often I think this is more people in clinical roles can view a career in care as a stopgap. How do we change? It's a good question. Thank you, Jasmine. How do we change that perception?
Very, very good question, Jasmine. And I think the opportunity is now. I've only had 5 years in this sector. So, and at times I still feel like the newbie. But for me, I just think that there's a real opportunity right now to build on the spotlight that is on us. I mean, let's be honest, day to day, we've still got to prioritise infection control, caring for our residents and patients, because COVID has not gone away and won't do for a while. But this is where, in my Zoom box, me and my guys, we need to build on that spotlight. We need to build on the conversation that's being had. Rest assured that Pete and myself and others in the bigger providers, we are lobbying government to ensure that the work that Matt Hancock is doing actually is fit for purpose, and is based on the reality of what's going on within the social care sector and the interdependency with the NHS. But I think it's about building on that spotlight. I know the government is leading on a campaign for recruitment into sort of short-term roles, not convinced of that, or longer-term roles. That's what we like. We've literally just launched on Monday our Barchester Careers website rather than the Barchester Jobs website that it was. And I think it's about taking the opportunity to really push out that it is a career option, and it's incredibly rewarding, mostly in a non-financial sense. But I think people are looking for that. I think there's been a real change in our community and how we contribute to it. And I think the social care sector can build on that.
Fantastic. Well, that's it. So, Genevieve, I know you've got other meetings, so thank you for taking your time. It was great chatting to you. I'm sure if people have other questions, I'll find you on LinkedIn or Twitter or wherever you hang out. But good luck with everything, and thanks for your time, and hopefully see you again soon.
Not at all. Thank you all.
Take care.